It's James with Net News Ledger. It's Sunday, February the 2nd, and here's the latest update on the coronavirus as it's affecting China, the world, and right here in Canada and northwestern Ontario. Stay tuned. We can report today that the death toll from coronavirus has soared up to 304 deaths in China. There's also been the first death outside of China as a man in the Philippines, a Chinese visitor who had been to Wuhan City, has passed away. The United States and many other countries are starting to impact travel from China, not only for people who are traveling from China, but also for their own residents and citizens who are coming back from China. There's a camp in California that the United States has now put 195 people into to quarantine them for 2 weeks to make sure that things are safe. We're getting a lot of information coming in over the last couple of days. The total virus numbers of death at 304 is not massive when you consider the population of China. But in China right now, they're building hospitals. There's 2 hospitals in the province where the virus started that are being built that are 1,000 beds apiece, and China is working on putting those hospitals together in under 10 days. Across the world, Israel is impacting travel restrictions. Russia has put in travel restrictions. Australia is literally quarantining people near Christmas Island, just south of Australia, for 2 weeks for people returning. Bangladesh has already evacuated all of its citizens and put a quarantine in effect. In Canada, Minister of Health Patty Hajdu is saying that the risk to Canadians remains low. There are travel restriction guidelines being issued by the government of Canada so that you don't do any unnecessary travel to China. Now, is this reason to panic? No, it's not. It's a reason to take precautions. A lot of the precautions that you can take are very, very simple. Wash your hands. Sneeze into your sleeve rather than your hands where you'd be touching all kinds of other things. If you feel sick, stay home. That's been the advice from the World Health Organization coming out globally. So it's nothing that you should be getting yourself all wound up and panicked about, but we're going to watch this story as it develops because it's taking a lot of people across the world and having them very concerned. And rather than create hysteria, rather than create racism and prejudice against Chinese people, we want to just follow the truth and report on the journey. This is James with Net News Ledger. I'm reporting from Thunder Bay, Ontario. If you found this video helpful, hit that subscribe button, hit that like button, share this video, and keep up to date on what's going on.